What is invasive lobular carcinoma, ILC, breast cancer? Imagine a type of breast cancer that begins quietly in the milk-producing glands of the breast and then spreads in a subtle, almost sneaky way. That's what invasive lobular carcinoma is. It starts in the lobules, which are the tiny structures responsible for making milk. And like the more common invasive ductal carcinoma that begins in the milk ducts and often forms a noticeable lump, invasive lobular carcinoma grows in a different pattern. The cancer cells spread out in single cell lines, making it harder to spot with a physical exam or even mammograms. Instead of a distinct lump, it might cause the breast tissue to feel thickened or hardened. This growth pattern means that invasive lobular carcinoma can be more challenging to detect early. Often, it presents with symptoms like changes in the shape or size of the breast, swelling, or skin dimpling. Sometimes, women notice nipple changes such as inversion or discharge, or they might feel a sense of fullness or firmness in the breast. Because it can grow subtly, it might not cause noticeable symptoms in the early stages, which is why imaging tests like mammograms, ultrasounds, or magnetic resonance imaging are crucial for detection. Invasive lobular carcinoma accounts for about 10 to 15% of all invasive breast cancers, making it the second most common type. It can spread beyond the breast tissue to nearby lymph nodes and sometimes to other parts of the body. While it often metastasizes to common sites like bones, liver, lungs, and brain, it can also spread to less typical areas such as the gastrointestinal tract, reproductive organs, or tissues around the eyes and brain lining. Risk factors for ILC are similar to other breast cancers. These include older age, hormone replacement therapy, especially with combined estrogen and progesterone family history, and inherited gene mutations like BRCA2, CDH1, CHEK2, PALB2, and 8TM. Personal history of lobular carcinoma in situ or atypical lobular hyperplasia, alcohol use, having fewer or no children, early periods, and late menopause also increase risk. Diagnosis involves a combination of physical exams, imaging tests such as mammograms, ultrasounds, and MRI scans, and most importantly, a biopsy to confirm the cancer type. Treatment options follow standard breast cancer protocols, including surgery, radiation, hormone therapy, chemotherapy, and targeted therapies. Because of its unique growth pattern and biology, treatment plans may be tailored specifically for invasive lobular carcinoma. In summary, invasive lobular carcinoma is a distinct form of breast cancer that starts in the milk-producing lobules. Its growth pattern makes it more difficult to detect early, but with careful screening and diagnosis, effective treatment is possible. Early detection and personalized care are key to improving outcomes. Always consult healthcare professionals for advice tailored to individual situations. Ongoing research continues to deepen our understanding and improve therapies for this particular breast cancer subtype.